Hi, I'm Matt Barnsley.
And I'm Erin Wagner.
Elizabeth Wilder.
And our group reviewed a study titled Specialized Nurse-Led Care of Chronic Wounds During Hospitalization and After Discharge, a randomized control trial. This study was conducted by a group of nurses. The lead reporter's name was Alessandro Silli, PhD RN. It appeared in the journal Advances in Skin and Wound Care. It was published in January of 2023. We chose this study because skin and wound care are areas of interest to us as we begin our nursing careers, and because it also met the assignment criteria.
This randomized control trial examined whether specialized nurse-led care for patients with chronic wounds provided during hospitalization and continued after discharge improves wound healing and reduces readmissions compared with standard care.
The study used an unblinded, two-arm randomized control design conducted in a single university hospital. Adult patients with chronic wounds, including vascular, diabetic, pressure injuries, surgical complications, and burns, were enrolled. A total of 1,570 patients participated, and 1,298 were included in the final per protocol analysis after exclusions related to loss to follow-up or non-adherence.
Participants were randomly assigned to one of two groups. The treatment group received specialized nurse-led wound care during hospitalization and continued care after discharge in a wound care nursing clinic, ensuring continuity of care. The control group received standard wound care provided by ward nurses during hospitalization and routine outpatient referrals after discharge, reflecting usual clinical practice.
The primary outcome was wound healing, defined as complete wound repair or closure with restoration of skin integrity. Secondary outcomes included 30-day hospital readmissions, treatment duration, and number of clinic visits. Statistical analysis included chi-square test for categorical outcomes, t-test, and ANOVA for continuous variables, relative risk with confidence intervals, and Kaplan-Meier analysis to examine time to healing.
Overall, the study was designed to determine whether specialized, continuous, nurse-led wound care provides measurable clinical benefits compared with standard fragmented care, using wound healing as a clinically meaningful outcome directly aligned with the research question.
The results showed significantly better outcomes in the nurse-led care group with a higher wound healing rate, 81.6% versus 17.8%, fewer readmissions, and shorter treatment times. The groups were balanced at baseline, supporting the validity of the comparison. These findings are clinically meaningful because they demonstrate substantial improvements in patient outcomes and reduced healthcare use. However, the study had limitations, including its single-center design, per protocol analysis, lack of blinding, and limited generalizability. Overall, the results suggested that specialized nurse-led wound care can improve healing and reduce hospital readmissions.
We choose to give this study 4 out of 5 stars. The research question was clear. The study was well designed, the statistical analysis is sound, the authors are transparent and free of conflicts of interest, the results were meaningful and clinically applicable.
Completing this project taught us how to read, assess, and understand scientific/medical studies. In our future roles as clinical nurse leaders, we will use these skills to help us shape how our units or clinics practice nursing. We will be able to find ways to solve problems and implement solutions based on what others have already studied. Thank you.
Thank you.
Thank you.